Everybody, Dr. Rafich from Vet Triage. We are continuing through this issue of JAVMA from 2014. This is Yersinia pestis infection in 62 dogs, 2003 to 2011. Yersinia pestis is a bacteria pathogen that causes the Black Plague. Crazy. And here is a scanning electron microscope of Yersinia pestis. So plague. This is wild. Objective is to describe the epidemiology, clinical signs, and treatment in dogs with Yersinia pestis infection in New Mexico. The study comes out of the Epidemiology and Response Division, Department of Health in New Mexico, and the Scientific Laboratory Division, New Mexico Department of Health. It's a retrospective series, 62 dogs. Confirmed case animals had isolation of Yersinia pestis from a clinical specimen, a positive direct fluorescent antibody test result, or a minimum 4-fold change between acute and convalescent serum antibody titers with clinically compatible illness. The latter part here, which is a minimum of 4-fold change between acute and convalescent serum antibody titers, they measure antibodies at one point in time. And then 4 weeks later, they measure it, or sometime later, they measure it again, and the amount of change between the acute sample, which is the first one, and the convalescent, which is the second one, tells you whether or not there's an active infection versus the dog just having antibodies because it was previously exposed to plague but doesn't actively have plague right now. Results found that 85% were confirmed by serologic titers alone or in conjunction with other testing. Clinical signs include fever in 100% of dogs, lethargy 97%, anorexia 77%, lymphadenopathy 23%, vomiting 13%, diarrhea 8%, abscess 2%. Right off the bat, you can tell from those lists of clinical signs that this is a very non-specific disease. So many dogs have these symptoms and don't have plague, which will make diagnosis tricky. Most case animals, 73%, were treated with multiple antimicrobials. 97% of animals survived. Possible exposure include hunting, rodent or rabbit exposure, and residence in rural areas. Introduction. The plague is a bacterial zoonotic disease caused by Yersinia pestis, transmitted by fleas, and affects mammals of several continents, including North America. Portions of the western United States are known enzoonotic foci of sylvatic plague, having a diversity of susceptible rodent and flea species, and mild weather that favors the maturation and vector efficiency of fleas. Enzootic means that a disease basically lives permanently in a specific region. That's what enzootic means. Results of a study in New Mexico indicate plague incidence rises with increased winter-spring precipitation, which results in increases in populations of rodents and other mammals, serving as hosts for plague-infected fleas and consequent flea survival. In New Mexico, the most common hosts from which Yersinia pestis have been isolated include prairie dogs, squirrels, mice, wood rats, rabbits, hares, and chipmunks. During epizootics, plague can spread to susceptible or accidental hosts. Transmission of plague to domestic carnivores, including dogs and cats, usually occurs through ingestion of infected animal tissue or a flea bite. Plague-infected domestic animals can be a source for human infection. Among domestic species, cats receive most attention for the direct transmission of plague to humans. However, dogs play an important role in the epidemiology of plague transmission by serving as a mechanical vector for plague-infected fleas. Dogs have been described as resistant to plague infection, and clinical signs in dogs believed to be less common than clinical illness in cats. After infection, dogs have reported to maintain antibody titers for up to 6 months. Domestic dogs in enzootic areas are exposed to Yersinia pestis and might become ill. However, to our knowledge, a comprehensive study of this has not been conducted. Plague in animals is a reportable condition in New Mexico. Diagnostic testing include isolation of the bacteria through culture or direct fluorescent antibody testing of tissue imprints on slides, lymph node aspirates, throat or wound scab specimens, or a fourfold or greater change in titer between acute and convalescent samples at least 14 days apart. Treatment for plague has been described in humans. Several antimicrobials, including doxycycline, gentamicin, and ciprofloxacin, have in vitro efficacy and are successfully used in treatment. Materials and methods. Fever in these dogs was defined as rectal temperature at least 39.17 degrees Celsius or 102.5 degrees Fahrenheit or greater. Lymphadenopathy, which in this case are also called buboes, B-U-B-O-E-S. Laboratory confirmed cases were those with one or more of the following. They had isolation of the bacteria from a specimen like blood, cerebrospinal fluid, liver, spleen, lymph node, throat, abscess, or lung, a positive direct fluorescent antibody test result, or a fourfold or more increase or change between acute and convalescent titers, drawn at minimum of 10 days apart. Although a minimum duration between samples was set, no maximum duration was used. Results. Peak months of occurrence were April, May, and June. 82% live in the northern central portion of New Mexico in the Santa Fe and Bernalillo counties. 68% classified as rural, 32% urban, median age 3 years, most were spayed females. 71% were medium and large breeds. Mandibular lymph nodes were the most commonly lymph nodes that were enlarged. Median intake or hospital admission rectal temperature was 40.4 Celsius or 104.7 Fahrenheit. Median time between onset of illness and recovery, which was defined as DFIRS events with noticeable improvement in activity level or appetite, was 2 days, ranged from 1 to 21 days. 44% were hospitalized, 42% were not, 97% survived, 3% died. Potential sources include hunting small mammals. A history of hunting rabbits or rodents or rodent exposure was in 58%. 47% had exposure to rabbits, which is the most common reported type. Rodents reported as sources of potential exposure include chipmunks, squirrels, mice, rats, prairie dogs. One dog became ill after consuming the vomit from another dog in the same house, which contained a recently ingested rabbit carcass, and both dogs developed plague. Fleas were only found in 3 dogs. All right, discussion. High fever was detected along with neutrophilia among many of the dogs in this cohort. Serologic specimens obtained 14 days apart increase the likelihood of detection of an increasing titer, although exact timing of seroconversion can be variable. Serologic testing may not detect acute illness, and most animals in this study had an acute titer of less than 4. Therefore, other testing methods, including culture of blood and bacteriologic culture or direct fluorescent antibody testing of lymph node aspirates or tissue, is also recommended. Plague is considered non-infectious in dogs and other animals after they have been treated with appropriate antimicrobials for at least 3 days. Fever has abated and clinical signs have improved. Repeating the antibiotics after a convalescent titer result is received and a diagnosis is made is not necessary unless clinical illness has not resolved. If plague is confirmed, the results should also be reported to a local or state public health authority. Plague is greatest in the western United States, specifically northern New Mexico, northern Arizona, southern Colorado, California, southern Oregon, and far western Nevada. I live in Nevada. Owners can reduce risk of plague in domestic dogs by removing habitats desirable for rodents and rabbits, like wood piles, debris, abandoned vehicles, excluding rodents from inside the home, limiting food and water resources for rodents and rabbits, including animal food and human food, and avoiding sick or dead rodents and rabbits, and their nests and burrows. Owners can also decrease risk to pets by using flea control and preventing pets from roaming or hunting. Plague serum antibody titers can persist for months or longer, especially in zoonotic areas where animals have repeated exposure to plague in their environment. Therefore, a single high titer does not diagnose the condition in New Mexico. This is gnarly, folks. That's crazy. I didn't think it was still around. I mean, this is 2014, but enzootic is enzootic, so that's wild. So cautionary tale for veterinarians. If you have animals that are from these problematic areas with these generic clinical signs, and plague has to be on your list. We'll see you guys tomorrow. Bye-bye.